I like my job because when you go home, you know you made a difference.
Because it's just happy. It's nice knowing it's a very rewarding job. Very rewarding when you've helped. It could be like the tiniest thing that you've helped someone with, but it's like massive to them.
Just generally making that difference, because like I say, some people don't see anybody, or they've got a son that lives 40 miles away that comes on a Wednesday, you know, and that's all they see in general. And it's just nice that you made a bit of a difference to them, you know, conversation, chat.
They are brilliant. Richard, the carer there, and Leah, the carer there, they are absolutely brilliant. I can't fault them.
It can be a very stressful job, but on the other hand, you get more rewards out of it than you do stressfulness. And it's nice going to service users and they smile at you. You made the day. If they walk in and they smile at you, you know you've done something right.
I actually did something completely different before, but because I looked after my grandma a lot, so it forced me to go in and help other people. So if I could do it for my grandma, I'd do it for everyone else. And best job I've had so far, to be honest.
Come in and I might be feeling a bit low, and Richard will say, "Good morning, Doris," and I'll say, "Good morning, Richard, good morning, Leah," and I might be feeling a bit low, and then all of a sudden, them just saying them words, "Good morning," and "How are you today?" and they cheer me up. Really, really lovely.
It's like a lot of people, I think, "Oh God, Karen, I couldn't do that." But community is so much different. Like some people will just go and see you to have a chat with them because they're lonely and they just want to see someone through the day. It's not all like just all physical work. Sometimes it's social and interacting with them. It is quite flexible. I mean, I don't have to dedicate. If I wanted to dedicate my life to it, you can, but you don't always have to as well.
Sometimes I feel like I could put my arms around them and cuddle them because they're that good. And anybody that says they ain't, come and see me, I tell you.
All the jobs I've done before here have been working sort of in supermarkets or in bars, and to be fair, I just wanted something different. It's always interested me, and I've always heard it's such a rewarding career, so I decided to make the change, and I've loved it ever since.
Got into care because my mum had done it for years and years and years. When I left school, I went straight into work in administration, and then but it was always something I wanted to do. So I'd been at my last job for 20 years, and I just thought, I just need to do it now. It's now or never. It's the best thing I've ever done.
Seeing people rehabilitated and go home, seeing families comfort knowing that the loved ones are looked after, or in worst case scenario, sort of at the end of their life, comforting family members. Yeah, it's definitely rewarding, 100%.
I love to hear the stories. I love to make a difference, you know I've made a difference to them. Maybe even if I've just spoke to them for 5 minutes in that day, I hope that I've made a big difference to them for that day.
When you see somebody go home, say if someone's coming on a short-term placement, they've maybe had an operation or an injury, and they needed us to help them while they were here, and then they've gone home and they carry on living their life independently at home, that's probably the most rewarding part, yeah.
I'd just say it's a very rewarding job. You can progress in the job. You can step up or just stay where you are if you want. It's just an amazing job.
The support for if you want to progress in this injury is incredible, and I mean obviously senior care you can still go further, which I'd love to do. It can be sort of a stepping stone for people who are then wanting to go and do the nursing degree and stuff like that. It's all about the experience and just seeing if it's for you before you carry on progressing further.
The residents, I love the job, I love being in the home. It's like going from home to home. My home to this is a lovely home, and just giving care and support, and just love it.
If you can do it and you've got the heart to do it, then it's definitely worth doing, because even like on a bad day, all the good outweighs the bad, 100%. It's a different kind of work, like when you get up and you actually enjoy coming to work in the morning because you know you're going to make a difference to somebody. I'd probably, like I say, I'd have just done it sooner.
First of all, Stuart's got his thumb up. We're live round the world on YouTube. I'd just like to welcome everybody, and before we start, to just make a couple of mentions of changes. And one person who we've always been used to having here was Kevin Dennis, but Kevin has moved on from the Police and Crime Commissioner's office, and we have in his place the invisible Sharon Cardwell. She's not invisible. She's not invisible. Hey, well, come on down and take your position, because come on down then. Yeah. Because we may want to ask you lots of questions. Where possible, people are here, but one of the presentations later on will be by link. Hang on, testing. How are we doing, Martin? Oh, okay, yeah, very good. Right, I just want to formally welcome Sharon Cardwell on behalf of the Health and Wellbeing Board as the representative of the Police and Crime Commissioner's Office. And that's exactly where Caroline Henry sat, the Police and Crime Commissioner, when she was here last. So you fill in her boots. So thanks very much. Now, somewhere along the line, we may up in the audience have our latest apprentice member support officer, James Harvey. If you're up there, James, you're very, very welcome to the meeting, and I hope you enjoy it. Minutes of the last meeting, these are really just for noting pages 1 to 6, if you can just make sure that they're an accurate representation. 1, 2, 3, 4, 5, 6, and just before we finish, I just wanted to remind everybody of how great the presentation was on the Not Alone website, and I've spent a lot of time since then telling every GP and every organisation I meet how good the Not Alone website is, including our own primary care network over in Nottingham West. And at some stage, Bryony, if we could have a follow-up with regards to its ongoing success, Colin, that would be really, really good. I'm going to go over for apologies for absences to Martin. Oh, yes. Does anybody disagree with the minutes? No, all clear. Go ahead, Martin.
Thank you, Chairman. So apologies that I've received. Councillor Susan Shaw from Bassett Law District Council, Lucy Dadge from Notts CCG, Melanie Brooks, Corporate Director for Adult Social Care, and Cash Ahmed is deputising for her. Fiona Callahan of Notts CCG with Dr. Nicole Atkinson deputising for her, and Idris Griffiths, the Chief Officer of Bassett Law CCG, has also sent apologies. That's it for apologies, Chairman.
Thank you, Martin. I'd like to welcome Cash Ahmed. He had a big box in front of him there recently, which was a present given to him because he's just turned 40. Happy birthday, Cash. We're familiar with Nicole Atkinson. I won't guess even what her age is, but she's the clinical lead for South Notts and the representative of place-based partnerships for South Notts. And we're very familiar with Nicole, and welcome this afternoon. Declaration of interests by members. If anybody has any pecuniary or non-pecuniary interest to declare, now is the time. No, that's all clear. And we'll move on to agenda item number 4, which is the Chair's report. Now, the Chair's report most recently has had over 100 items on it, and I was mighty relieved to see that we only got to 50. And we're trying to tie them in to some degree with the items on the agenda for the afternoon. And I'm going to start off with item number 2. Showing how fantastically well that we're actually doing with regards to vaccinating the population of Nottinghamshire, and the figures speak for themselves, with over 84% of over 18s having had 2 doses. Myself and Jeremy and Nicole will be familiar with the challenge that's out there getting people in for booster doses, etc. And throughout January, personally, the biggest challenge we faced was the fact that the number of people who had COVID, and when you had COVID, you couldn't have your booster jab for 28 days till you'd overcome it. So there was technical hurdles out there to get people in because the sheer prevalence of COVID was making it tricky. But there are lots of opportunities out there. There are an excess of appointments out there. It's very easy to get your first, second and booster jabs, and we need to continue to drive home that message that that's the thing that we wish to see people doing. I just picked up on the 31st of January the change in the government policy, where previously, if you worked for a CQC regulated organisation, you had to be doubly jabbed by the 1st of April, and the government and Sajid Javid have put in place a consultation over the next couple of weeks to try and revoke that regulation such that it's no longer necessary for that to be the case, bearing in mind that over 70,000 people could have lost jobs potentially. The argument was that it was no longer proportionate to the problem which we faced. In other words, that they would look back and say the Delta strain was a much more virulent strain, more hospital admissions, more intensive care beds, more deaths, and they would see the Omicron as a much less virulent and perhaps even more benign. And that's the logic behind the revoking of the requirements from the 1st of April for people to be doubly jabbed, and if people have been served notice, that they should be able to have that notice revoked. So that's where we are up to COVID. I'm going to move on from COVID. We've got quite a lot about nutrition in there, and we'll come to that with some fascinating presentations on sustainable food places later. And as I go through it, I'm going to go to item number 24. Item number 24 is looking at the 50th year anniversary of ASH, the Stop Smoking. And we have to remember that smoking remains the single leading cause of preventative illness in the UK. And it's easy sometimes to forget that the big things are still as important as ever. Smoking itself is still responsible for over 50% of the entirety of health inequalities that exist in Nottinghamshire. So for the people who live in Rushcliffe that live 7 years more than the people that live in Ashfield, for the people who get ill 14 years earlier than the people in Rushcliffe, 50%, exactly half of that discrepancy and inequality is still related to smoking. So it's one that we mustn't take our eye off the ball with regards to as we drive ourselves towards a non-smoking society, which will be when we get the population of smokers below 5%. It's interesting that it continues to put out the government's position and National Institute of Clinical Excellence, and it talks about continuing with nicotine patches, etc. But it also champions replacement therapy in the form of e-cigarettes. And whatever you think about e-cigarettes, they are infinitely less harmful than smoking itself. Our big challenge is to get e-cigarettes available in the services for stop smoking that we offer throughout the county. And that continues to be a challenge. The main problem is that when people use nicotine replacement therapy, after 12 months, the percentage of people who are still using it is tiny. Whereas if you use a e-vape, something like 90% of the people could still be using it after 12 months, although it remains a very safe way to stop smoking. So we're going to continue to push the message of smoking, and it remains high on the Health and Wellbeing Board's priority to reduce smoking to improve health inequalities over Nottinghamshire. Another biggie which is down there, and it's the drug and alcohol at 29. and the importance of that, and it's great to have the representative of the Police and Crime Board here, is the approach that we're having now to alcohol and drugs. There have been more alcohol-related deaths over lockdown. There have been in the history of records. So alcohol-related deaths remain enormously high. In terms of drugs, Dame Carol Black has proposed that they are potentially able to look at drug addiction as a public health issue as opposed to a criminal issue. And I think that that's something certainly being championed in the public health side by the Police and Crime Department as they move forward. There was a budget put forward of £780 million to try and improve our activities in those areas, particularly with regards to reducing the criminalisation of people and smoking. 3 areas, Sharon: breaking the drug supply chain, delivering world-class treatment and recovery services for people who actually use drugs, and creating a generational shift in the demand for drugs, which I think is a very admirable goal. So drug and alcohol, again, on top of smoking, remain the biggies. £780 million to fund 3 years of ambition. And Sharon will be able to tell us how they're spending that £780 million hopefully at some stage. I'm just going to jump towards the end of those top 50, and I'm going to look at number 47, which is England's ageing population, and the fact that the Health Foundation are looking at the estimated social care needs of the population as we move forward. We're all traditionally aware of the typical pyramidal diagram showing populations around the world, where the bottom of the pyramid is the young population and at the top is the very old. And over the last number of years that's become more cylindrical, where the number of people at the different age groups are actually quite evened out as people live longer. And indeed we're likely to end up with an inverted pyramid, where a tiny number of young people support an ever increasing and ageing population. The first country that's going to get to that stage, where over 50% of the population are retired and supported by the smallest number of taxpayers, is going to be Japan. And then in due course, obviously, Britain will follow them there. The challenge of that is that if you look after the potential cost of social care for the elderly by increasing tax like national insurance, then the small percentage of people who are paying taxes end up paying for an enormous amount of people who've retired, and it needs a multi-pronged approach to that, such as the Japanese have. Some long-term insurance care plans, etc. So it's coming down the road to all of the established countries, and it will demand quite a wide-ranging, multiple approach to the management of the social care of the elderly population as we move forward. As I say, the tax-paying population will dwindle in comparison to the ageing population that requires care. So I'm going to stop at that moment in time, and I'm going to throw it out there for anybody who has read through all of those 50 points and it's kept them awake at night with some burning question that they've come here to ask today. And Henry has been kept awake all night, I can see. Councillor.
Yeah, I just wanted to make comments on the smoking cessation side of things, because I'm very concerned that a lot of young people are taking up vapes. There's been an exponential growth in young people taking up vapes. I'm talking sort of under the age of 18 and even younger, from 12. I've seen young people as young as 12 taking vapes, and I think there's a lot of work needs to be done around that to prevent that from happening, because, okay, young people aren't smoking as much as they used to a few years back, so I've seen a reduction in cigarettes, but I've seen a quite a big increase in vapes in different settings, including youth settings where they're actually banned. We're constantly having to, young people are constantly being told to take vapes outside, because it is council policy, county council policy, not to have them on youth premises or council building premises. So I'm very concerned about the growth in young people taking up e-cigarettes, because I think there may be, I mean, I don't know, but there's possible health effects that might impact later on that we're not aware of. Thank you.
Councillor Wheeler, I think that's probably shared by a lot of people around the room. I think a large part of it started with the reports from California on E-Valley, which is e-cigarettes, vaping, acute lung injuries, etc. But often were found that the Californians like to include THC, tetrahydrocannabinoids, and other forms of drugs with the nicotine, and therefore in the UK the amount of acute lung injuries are very rare indeed, and even the most vehement respiratory specialists around the country still champion the positivity of the 90+% reduction in the harmful tars, over 100 carcinogenics that exist within cigarettes, and therefore they're very pro-vaping. I do look after a young offenders or young children's institution, and I was in there earlier in the week, and I always ask them whether they're smoking and drinking, and they said, I vape, but I've never smoked. And he likes one of the cherry flavours or something like that. So it is a reality. I agree entirely with you, Councillor Wheeler. Director Gribben, have you got anything to chuck into that?
Just one thing to chuck in. So the report also set out some of the revised recommendations that NICE have come forward with in regard to e-cigarettes more generally, and the role that they play in helping people to quit from smoking. So the position of Nottinghamshire County Council as a Health and Wellbeing Board partner remains that in our services we continue to support people who are wanting to stop smoking, irrespective of what method they might use. So that would include people who are using e-cigarettes. One of the things that we'll be doing over the coming months as part of our pandemic recovery plan is to complete a piece of work which got paused 2 years ago. And that was working with partners across Nottinghamshire to review our tobacco control arrangements in the round. And as part of that, we want to take a fresh look at e-cigarettes, and Councillor Wheeler, we're happy to give further consideration to what you're highlighting, notwithstanding the important role which they can play in helping people to quit smoking as well. Thanks.
Councillor Tideswell.
Thank you, Chair. I'm referring back to item 4, Nottingham County Council's new council plan. I'm all for the levelling up, especially in the area that I represent in Broxtown. But unfortunately, to my surprise, I heard 3-4 weeks ago, which interacts with this levelling up for young children and babies, that apparently the Nottingham Health Service is not willing. If a baby is born with tongue-tied condition, they are not now willing to operate to do corrective surgery. It has to be done in private. So as good as our plan is, unfortunately, it's going to be the health service that is actually holding back. If mums want to breastfeed, or they've got to have special teats in the bottles and everything, places where I come from, a lot of the parents are being discouraged, and also the extra expense of buying specialist teats, which I was surprised, which annoyed at.
Thank you, Councillor Tideswell. It was fantastic to have you at the Health and Wellbeing Roadshow in the Beeston Library with myself and Bryony, and we had some fantastic contributions for what you would like to see in that area, and we've assimilated that into our longer term plan. Tongue tie is interesting in that the common pathway as it exists is a referral through to paediatric surgery, and I have referred people through recently, and haven't heard anything about people being unable to access that service, but I'm certainly going to look into it. And secondly, it is one of those areas, a little bit like circumcision in a way, that people often go and pay for. It's very expensive. You can go to see somebody and it takes them about 30 seconds to separate a tongue tie. For people not aware of it, the tongue can't come out past the bottom lip in order to be able to suck properly for breastfeeding, and it's a very noticeable condition, and people don't wait often for the NHS to actually go and pay for it. About 200 quid. It's that, I looked at it and thought, I might set up my own tongue tie service. It was that lucrative when I looked at it. But yes, when I brought it up, particularly in Stapleford, and I brought it up with the 3 practices in Stapleford, and I said, have any of you guys ever had a problem with referring somebody for tongue tie? Because it came up a couple of months ago, and that's why I'm aware of it. And we established that this pathway does exist. But if for any reason there's a problem with that pathway, Colin, I'd like to know about it. Thank you. Councillor Walters.
Yeah, thank you, Chair. Just going back to vaping, ping-ponging back and forth, has there been any studies performed, or do we have any results of the potential harm that vaping causes? Has there been anything from the wise guys at the top?
I'm going to go to the wise guy at the bottom, Jonathan Gribben.
Definitely the bottom, and I'm not sure about the wise bit. So I'm not going to attempt an all-round evidence review on the fly. What I will say is 2 things. The piece of work that I mentioned that we'll undertake with partners across Nottinghamshire, looking at tobacco control in the round, amongst other things, will take account of what evidence there is around vaping more generally. I am aware that I think it was certainly pre-pandemic. I think it was 2019. There was a trial which looked at the role of e-cigarettes in helping people to quit. And the rate of quits amongst people who were using e-cigarettes, as I recall, was about twice as high as those who weren't using e-cigarettes. Now, that on its own, as a piece of evidence, is only just one part of the picture, but it illustrates why there is such a lot of interest in making sure that we properly harness e-cigarettes in Nottinghamshire to help people off a habit which, as Chair pointed out earlier on, accounts for up to half of the health inequalities that we see in the county and indeed elsewhere. So there are several other pieces of the jigsaw to fit together and for us to adopt a really robust view on how we can properly promote e-cigarettes in the right settings, but also taking account of their potential harms in terms of the concern that some people have that young people coming into vaping then use that as a pathway into cigarettes. So those are some of the concerns that we'll be looking at in due course. Thanks.
Any further questions with regard to Councillor Tidwell?
Thank you, Chair. Yeah, just the vaping and the smoking as well. It'd be interesting to hear from the police commissioners on the legal aspect of the selling of vaping and cigarettes to underage people, and if their thoughts are in alignment with ours.
What are our thoughts, Councillor Tidwell? What thoughts are you talking about?
The actual shops where they are being sold at, whether they are being appropriately monitored, the legal situation around that area, and what the police commissioner's response is for it.
I can see Sharon writing furiously over there, but I'm going to go to Director Gribben first.
So, with your agreement, Chair, and with Sharon's agreement, what we might do for the board is, having undertaken the piece of work which I was mentioning, It goes by the acronym, the CLEAR process, and it's a way of really assessing your arrangements around tobacco control as a whole partnership. Once we've done that, with your agreement, Chair, we might bring that back to the board as a report, and we'd perhaps get some input from Police and Crime Commissioner's office to make sure that we're covering that off in the round, including the control elements that the police are most interested in.
Yes, fantastic. Sharon, did you want to come in?
Yes, just happy to agree that, Jonathan, and thank you very much for that offer. That makes a lot of sense in terms of bringing it together as a whole system approach, if you like. I think I just want to make clear that we haven't got a policy approach on it in terms of Office of Police and Crime Commissioner, but the monitoring of it very much does fall into the operational space, which Chief Constable and police are responsible for, but that is part of the governance and assurance work that we do with the force.
Thanks very much. I'm going to move on from the Chair's report at this moment in time and move on to item 5. Item 5 is working together to address inequality and inactivity across Nottinghamshire. Inactivity and inequality often go hand in hand. Something like a quarter of the population do less than 30 minutes exercise in a week, let alone the required 90 minutes which we would like to see. This paper looks at the physical activity across Nottinghamshire, particularly with regards to how it relates to sustainable places, etc., and is presented by Active Nuts, Karen Chamberlain and Ilana Freestone. So I'm over to Ilana first, I believe.
Thank you, and thank you for inviting us to the Health and Wellbeing Board today. Can you hear me? Is the microphone in the right space? Good, great. So I've got the easy part. I'm just going to talk to you about making our move, and we've actually got a video to show you. So I'm not going to say much other than a bit of context to the strategy, which is a county-wide approach, whole system approach to addressing inactivity and inequality. About a year ago, we had a national strategy from Sport England. It's called Uniting the Movement, and this, in effect, is our local response. And it is about a movement. The national strategy set out to transform lives and communities through physical activity, and it recognises the range of partners that need to be involved in that. And a key component of that national strategy is around connecting with health and well-being. It's one of 5 key priorities. So this making our move that we'll hear about in a minute is our local response. We started the process about a year ago, and we've had lots of conversations with over 700 people and organisations, and you may have seen some of the slides, you may have been part of those in districts. I think we've had at least 1 or 2 conversations in each districts in the development of this. And we've also lived experience and resident voice has fed in very much too in terms of the insight. We've looked at all the evaluations, the programmes, the work that we've done over the last 4 years, which again many people around here have been involved in, and you'll hear about in a minute from Kerin. And that we've used that to inform what's needed next. And this is at headline level, and then we're working out the detail in terms of an implementation plan. But before I just press play on the video, we haven't got this on the slide, but we'd just like to reflect on a couple of questions that would be good to bring into the conversation later. One is, I guess we'd be interested to understand, how does moving more and physical activity matter to you and your work? And the other kind of visionary one would be, if all areas of health and care system fully supported and enabled active lives, what would this look like? What would it take? And what might get in the way, just to start thinking about what can we start to do together? And the final kind of reflection would be, if we were able to work towards this together, what would the next steps be? And that would be a good consideration for this group. And we have got some summary versions of the plan. There's a more detailed version online, which you're more than welcome to take away. And we've got, as a spark of motivation, a couple of resistance bands, as we're all spending so much more time in front of screens these days, that we're sitting there giving an opportunity just to do some movement whilst we're whilst we're working. So feel free to help yourself to those
Ilana,
at the end.
could I get you just to repeat those three again? They seem to have gone right past me. Those three visions you wanted us to think about.
The question. So
Yeah.
we'd just be interested to understand, how does moving more and physical activity matter to you and your work? And if all areas of the health and care system fully supported and enabled active lives, what would this look like? What would it take? What might get in the way? And finally, if we were able to work towards this together, what would those next steps be? Oh, Brian, are we okay to? So this is a summary, and then I'll hand over to Karen, who'll talk through some of the detail and how Nottinghamshire Works fed into this.
Making our move, our shared vision for uniting the movement in Notts and Derbyshire. As communities, organisations and partners working together, we will address inequality and empower everyone to be active in a way that works for them. But why is this important? Firstly, we'll be healthier, happier and more fulfilled. Secondly, communities feel safer, inclusive and connected. Thirdly, society is more equal, with money invested and saved in the right places. And finally, our environments are less polluted and better appreciated by communities. Our shared aims, what we're going to focus on. Creating a culture where everyone can be active and move more. Enabling children and young people to have a positive experience of being active throughout their childhood. Working with people and communities experiencing the greatest inequality. Maximising the potential of being active to improve physical and mental health. Creating accessible, safe and inclusive places and environments for physical activity. Across all our aims, we will recognise the importance of walking that is accessible to everyone and promote the benefits and be conscious of the impact of physical activity on climate change and the environment. Through being active, we can create a fairer, stronger, healthier and greener society for all, which is especially important as we recover from COVID-19. How will we make our move? The power of a united approach. At the heart of this is people and communities owning the change they're trying to create by being involved and feeling empowered. We recognise that everyone and every place is different. We'll grow our insight and understanding of people's behaviour. We need to understand how the environment impacts on being active and how our complex lives can make it difficult. Part of this is valuing different perspectives and the lived experience of communities. There are lots of people and organisations who have a part to play in helping people to be more active. This is our workforce. Key to the success of making our move is more collaboration across and between partners and sectors. We'll need to learn from what is and isn't working and adapt as we go, alongside advocating and influencing for changes to policy and practice. We can do more to ensure that our strategies, governance and processes support and enable active lives and environments, services and programmes are safe and accessible, designed, planned and delivered with being active in mind. How we invest our resources, both financial and human, ensuring it's proportionally focused on where the need is greatest, will be important. Lots of our aims and ways of working are interconnected and interdependent. We know it's complex and we need to work with this. Time to make our move. We all have a part to play. We need to be united. We need to build from where we are and act together. Now is the time to make our move. Making our move.
One is creating a culture where everyone can be active. Lots of that's about messaging and being united in that and consistent around that. Enabling children and young people to have a positive experience, and we're talking about a whole range of forms of movement, sport, physical activity, and just moving more as well. Working with people and communities who experience the greatest inequality, is a key priority, as is maximising the potential of physical activity to improve physical and mental health. And the environment is in there as well, in terms of creating safe and accessible and inclusive places and environments. And cutting across all of them, hopefully you picked out of that, is the potential of walking is really significant across all of those aims, whether that's walking to school, walking for leisure, walking for travel, walking, any form of walking. And that walking contributes to the majority of people's activity minutes, and we've got data around that. So it's an accessible form of activity. And the other kind of factor going across all is carbon footprint and the impact on the environment. So those considerations feed into all of those aims and actions. And I'm going to hand over now to Karen, who's going to bring to life the how.
Okay, so I'm just going to give a flavour of some of the work that's been happening across the county in every single district in Nottinghamshire. It started off with Mansfield as an early adopter of the work, if you like, and that was great because there was real energy, and they clearly stuck their hands up to try something different and to do a bit of testing and learning. And we did this focus down into the Bellamy estate, which you may be familiar with. We grew this opportunity from the learnings that we galvanised from the work in Bellamy, and then tried to work out, is there an opportunity to do this wider across different areas of Nottinghamshire? So that's what we did, and that's what this piece of work is essentially all about. Bear in mind that I'm simply a mouthpiece in this. This is not Active Notts' work. This is a collective piece of work which has been working with the district councils, been working with public health across Nottinghamshire, and other partners in the CCG and the health world as well. So it's evolving, and we talk about it as an approach rather than we sort of ban the P word, which is project work, for good reason, particularly around perception from residents, etc. So just to set the scene on that, just to utilise a phrase from Councillor Doddy earlier, that multi-pronged approach. We know that this work isn't a single intervention. It's not a single organisation's role to do this or job to do this, and it's how we can do that together. The purpose of this piece of this approach was to build an understanding of communities where the inactivity and levels of healthy life expectancy was really low. So we really focused in using big data to start with, and then drilling down. And we could have picked probably 50 different places in Nottingham across the board, or Nottinghamshire across the board, to do this. But then we had to really focus, and there was decisions at local level through the district councils and other partners, community voluntary sector organisations, etc., to really let's do a test and learn in a focused community and what that looks like. And the main thing is they're all so different. And that's one of the key learnings there, is that it's not one single thing that's going to be effective there. We looked at it from a systems-based approach. And with that systems-based approach, we were looking at, how do we build on the strengths in a community? But first of all, we've got to get to know the community first, get to really understand what's going on, what are residents saying, what are the organisations that really hold those trusted relationships within those really small communities, and what's there to build on, whether it be an asset, a physical asset, or actually just about people. Who are the people and the organisations and services that are operating in there? So we just pop onto the next slide, please. There were inputs into this work, obviously. And this is about a unique group of partners coming together around a place, and really taking the mantra of there's nothing for us without us. Really understanding that it's not about helicoptering in, it's not about us as system partners going in and we can solve everything for you, we can do everything for you, having that paternalistic mentality, and we will kind of sort you out, because that's the project mentality, that's the short term. We know that doesn't work. And the residents in the communities knows that doesn't work. So we had a collaboration of partners to start off this work. We also had co-funding, and that co-funding was really great because it wasn't therefore a transactional relationship. It was everybody puts a bit in to be able to create something that we can then work together on. And we had an evaluation wrapped around all of this, so an independent organisation who came with us in the work. So they weren't just bobbing in and out, they were absolutely in the conversations with community organisations and residents across each of the 6 places. And Mansfield, as I say, still carries on. It's evolving. It's still working. I'll talk about, you know, where the work's got to in each of the places as well. So if you go on to the next slide, please. We have 6 themes that have been identified. They're in no particular order. One's not more important than another. And it's really important to recognise that, and some of them are overlapping as well. But from the evaluation and from the learnings, these 6 areas were really, really key. And this was about learning as we go, and what have we learned about this place-based, asset-based, community-based way of working, and what are the conditions that need to happen in order for this to work, because we're talking about that cross-cutting whole system approach. It's multiple partners, etc. So those 6 key things, I'm not going to go through each one of them. You know, you can have a look at them, you know, on the screen for yourself. But it's different things in different places. And sometimes it was maybe the system got in the way. Sometimes there was less of an appetite from partners in the system to do this type of work or work in this way, which is not straightforward. Some were absolutely great, let's really embrace it, and it flourished and it kind of picked up speed a lot quicker. Sometimes there was a changeover in really key people left, and then obviously there's COVID. So we had COVID within the middle of this, but actually what was really interesting, by starting this work and building and working with the community and all the organisations within that community, during the pandemic, we were able to mobilise and help and enabled the population of the community to be stepping forward and doing things for themselves, and recognising that coming together through that trust that had been built up through the work. So if we just go on to the next slide, you'll just see a bit of a visual there. This is just one of the 6 areas. This is Ashfield, for example. We could have picked any of them, but this is the community that was chosen was Coxmoor. And this is just a visual, probably representation really, showing that the system and the partner perspective, and where it started and how that shared purpose has got to be created first, which takes a little bit of time for partners to come together, for partners to trust each other, and really to go, why are we here and what are we doing within this approach. It's also appreciating how it links with the wider determinants of health, which have a massive impact on it, and the impact on health inequalities too. So whilst we didn't go in with a conversation about physical activity, we went in with a conversation is, what's it like to live here? What's it like to work here? What's it like, you know, tell us how you're feeling, which then takes you to much broader understanding of the people living within a place. So the next slide is just really moving on from that. It's really, and this is again Coxmoor still, and this is about understanding what's important to people living within Coxmoor. And it's really surfacing that perception versus reality. Why would we know, the bigger we, know what it's like to live on Coxmoor Estate, and the challenges that people, families, individuals have across there. And that's just a representation, and there's probably loads more in there, but that was just captured at that point in time, very early on in the work, if you like, when it started in about 2019. And it's really interesting, some of the things that come out, just some of the things that they're focusing on: a broken swing, the grass is too long, my children can't go out to play, all contributing as to why something that we might not think of, but actually it's the reason why they don't feel that they can be physically active. It might come down to safety. It might come down to, or perceptions of safety is a really key one. You know, an example of that where we had groups of young children hanging around a pub area, and there were just young people hanging around this pub, and it seemed to be, lighting wasn't great, it wasn't, you know, particularly clean area, and residents said, we don't go over there, it's you know, it's there's antisocial behaviour going on, etc. The reality is the young people were just feeding off the Wi-Fi from the pub. They were using their phones. So when the conversation with the PCSO was happening, you know, what are you doing around here, guys? It was that they were just downloading free Wi-Fi to use on their phones. So again, asking those questions and that perception versus reality is quite important. So on to the next slide. And this is just the next bit onto that, is coming back to that, and from what we're hearing, what we're seeing, is how can we make the most of our collective efforts? What needs to happen? What can be enabled? But the really important thing is that what can be enabled by the community, for the community, with the community. And that takes time, and it takes time to build trust. One thing we did hear, certainly from the Coxmore residents, was a distrust, particularly in the system. For whatever reason, again, perception versus reality, but this was their reality. They didn't trust you know, certain statutory bodies, etc. Or, oh, we've told you this before, you didn't do anything, so why would I speak to you again now? So it's that, you know, once bitten, twice shy. And we had to get over that and start building that back up again with trusted sources in the community. So that's just a bit of a flavour about Coxmore. Again, we've got 6 examples of this. We have an insight document for every single district, and then we have a document which also articulates value. So the values of the work, what have we learnt? And if we're going to do a place-based, community-based approach in other places, what, you know, rather than starting from back here, is where we were, what is it that we can utilise? And certainly, and I don't know, Dr. Atkinson, Nicole is involved in some work from NHS England around place-based work that's happening. Funnily enough, one of those places is Coxmore and also Bellamy. So it's bringing you a standing start to additional place-based work that's happening, and how can we cross that line across into health. So one of those values one of those learnings was really genuinely empower residents to make change as a key part of a way of working. So we've just got a real quick soundbite from Andy from Newark and Sherwood CVS. Sorry.
Sometimes maybe there is a reliance on the council because it has been done to them in the past. I think there's also a lack of confidence in, this is quite generalised, but I think when the community garden's a great example. It took some getting going, and it's been really slow, hard work. Now there's a core of volunteers, and all of a sudden it's thriving. And when people can see that, they can almost see the light, and they realise that they can do it, all of a sudden things just take off, and it's like petrol on a fire. It goes all of a sudden, but it's that so slow, putting the little bits of the wood around the fire to get it going, you know, and then belief, confidence, not always, but I think it's there, but the issues are definitely there.
That's just bringing to life in one small place. We've got lots of sound bites. We had lots of audio interviews, etc., with not just the organisations, but going down into residents as well. And, you know, we talk about the bingo ladies in Mansfield. We talk about, you know, what's right for them. We talk about families and young people. We talk about young people, particularly in Newark and Sherwood, where a lot of this work started in Newark and Sherwood, and how that's joined up in Ollerton, for example. So just in summary then, and obviously we'll take questions on that. Andy's just interrupted again. So this work, it's really provided an opportunity for community stakeholders across the localities to come together and understand and experience and immerse themselves in what does this asset-based approach look like, because it's quite foreign to many, particularly those working within district councils, this way of working. But it's really about going where the need was, around those areas with the highest health inequalities and lowest levels of healthy life expectancy. We've also used, it's really helped to raise the profile of complex challenges of being active within these parts of the community. As we say, we're not making widgets here. It's not A plus B equals C. It's really complicated about people's lives. And it's certainly more than about helicoptering solutions or a one-size-fits-all solution. And we need both buy-in from partners, organisations and the residents in order to enable this to happen. It's also helped us to build up a real detailed picture of our communities, but working on that real strengths-based approach and understanding some of the challenges around providing services and opportunities which are right for those people who are living in those communities. You know, it's that services are put in and it's going to be at 2 o'clock on a Tuesday in a place that they can't get to. So is that really fit for purpose, and should we be really looking at that? And it's that tailored offer, you know, youth sessions. If we really focus on young people, have we asked them? Do we really know what they want and need? Rather than saying, actually, we'll just open a youth club or something in a place that actually there's no buses to get there or they can't get there, you know, thinking all of that through. Community gardens, which was mentioned. So when we talk about being active and moving more, it's in the broadest sense of the word. It's walking, it's low level. And then it's about how do we develop greater capacity among our partners? So when we do get additional investment and funding coming in, is it going into the right places? Do we know that? Or are we just putting our finger in the air and going, oh, it's such and such's turn, or, you know, we're going to do it across the board? And a really great example of that was when we had Tackling Inequalities funding coming down nationally. We were able to signpost it into the right places and the right intervention, particularly over COVID, where we were able to work with families and young people and organisations in these communities to enable them to be more active, so activity packs, etc. Through schools, for example, we know that in many cases the heart of a community is the school that happens to be there and the young people and the families that engage with that. And then onto the final slide. So it's how we've really pulled together to create a range of values across and between organisations around insight and evidence to inform planning and decision making. An example of that is in Mansfield, where the play park was decided in Bellamy Estate. It was full of glass and needles and really not a nice place to be. Therefore, it was never used. So there was some investment that came through from partnership investment that came together to really enable that to happen. And what happened at first is the architects and the planners decided what that looks like. So they do some nice pictures and they presented that to the community. And they quickly had to retract that because we haven't spoken to the community. And actually when they did that, so before they put up their shiny new pictures, it was pulled back and said, can we do this in a slightly different way? And that slightly different way was actually what was done in the end, which was involve the community, and residents looked very, very different to what those original planning pictures looked like. And with that, the community took responsibility and took that ownership in keeping it clean, keeping it safe, really valuing it because they'd had that input and had that voice right from the start. But before that wouldn't necessarily have happened. Architects and planning would have gone in, and there you go, it's a play park, job done, walked away. There's also you know, there's loads of examples as to where I can pick out, and I'm very conscious that we don't have that much time really. But whilst this piece of work we collectively invested across all of the partners, to date £120,000 for the 6 areas. But what we've also managed to do is leverage in excess of £180,000 from national through other funding partners, from National Lottery, Children, whatever that is, and we've helped to click that together because we can prove by doing this work we understand our communities, we understand the insight, which is much, much more than numbers and much, much more than data, and how we can sort of join all up. Moving forwards, there's, as I said, that place-based approach and that way of place-based working. Certainly the NHS are starting to explore and working in this way as well. So, and I mentioned before, in Coxmore and Bellamy, that's where the work will continue to happen through that, with absolutely that sort of health angle. There's other work, particularly in PCM West. Nicole's going to correct me on this, but in terms of the co-production around community services piece of work, we have 3 test and learn sites. 2 of them are in the county, one in Broxtowe, I think, Nicole. Yeah, and there's another one. Yeah, that's the whole of the Mid-Knots, yeah. So Mansfield, Ashfield and Newark and Sherwood, this work will absolutely feed into that. And then there's the investment of the place-based investment in the likes of Killissick. So, and also I think Bellamy, and there's some other couple of places as well. So all of this learning will absolutely feed in and help inform and bring that up. So it's about the what next. It's about where it goes to. It's about maintaining that momentum and working with partners wherever they are in the system. I think that's me.
Well, I must say that was quite a tour de force from Karen and Ilana. It makes me want to get everybody up to do some star jumps. But I'll hold off on that just for a moment or two. It really was, and as you said, you could have had a whole afternoon dedicated just to activities. And I remember when you first went into the Bellamy estate a number of years ago, and it was like a 1-year project where you had to go into the deepest, darkest, most inactive street, because the biggest returns come from targeting the most inactive people, and how you have to be somewhat selective in a pace-based approach, as opposed to what we often do, which is a universal approach to tell everybody to get out and do some exercise, where you're saying that yes, it can be over a place-based, a selective approach, but it takes time, it takes a mind change. I'm particularly interested in the element about safety, and perhaps Sharon will come in with that at some stage, that people have to feel safe to actually go out and to walk and to go around the place. You mentioned other things such as buildings, etc., and houses. And a few years ago, the Health and Wellbeing Board approved the health and spatial planning, where any development over 50 houses had to go before its planning committee and ask what is the impact on the health of the population with regard to this. Some adopted it as policy, some just kept it as a reminder of what they were looking for. And there's been many studies showing that if you live close to a green space, there's a 40% greater likelihood that you'll go out for a walk than if you live in a built-up area. And so all of the statistics and all of the things that are out there support exactly what you're trying to say. And it is like a domino effect. I remember the first lockdown in COVID and watching people go out to walk in the beautiful March weather. People who had never walked before, walking around Stapleford, etc., as though they'd landed on a foreign planet or something like that. It didn't last, unfortunately. By the time the second lockdown came, they'd had enough of it all. But it showed you that people, given the time and given the encouragement, etc., can get out to become active. Be interested to see what you feel, whether or not it's been a positive or a negative for people working from home. I always thought that if you give people a year off or furlough them from a year, that we will get one of the greatest, fittest, healthiest populations in the world. And yet it turned out to be almost exactly the opposite. But if I said to you in the morning, I'm going to pay you for a year to sit at home, what would you do? You'd bite my hand off. And yet the reality is that it's so complex, as you say, that it's not as simple as it seems. So absolutely fascinating. I'm going to throw that over to everybody. I'm going to actually start and ask Nicole to bring us up to speed on place-based interventions, particularly because she's the clinical lead for South Notts, which is huge, and this is the vehicle through which the integrated care service is going to develop the changes in the community to make us all healthier and live a healthier, longer life. Nicole.
Thanks, John. How long have we got? Because actually, if I sort of tell you about how some of the health and care services is coming together, it might take a while. But what I will say is that across the county there are 3 what we would call places, and I know it's very difficult because actually we use different terminology, and actually we may be talking about the same thing or we may be talking about different things, but certainly for the county we're looking at South Nottinghamshire, which covers sort of Broxtowe, Gedling, and sort of Rushcliffe kind of areas. We've got Mid Nottinghamshire, so Newark and Sherwood, Mansfield and Ashfield, and we've got Basset Law, and actually Basset Law is obviously becoming part of our sort of Nottingham and Nottinghamshire ICS. I know it has always been part of the county, but from a health planning point of view, as of April, that will fall into our integrated care system. So essentially they are partnerships. They're partnerships of commissioning organisations historically, but also provider partners, and in a way that we've started to work much more across boundaries. So this isn't about health, this is about all of us working for our local community. So again, Active Knots is one of our partners in our South Nottinghamshire sort of place-based partnerships, and very much it's working together to how we support our local communities, hence the work that's happening in our area, but also in Mid Knots. So I think you'll see much more of this as we start to motor, really. I think a lot of it has been that kind of concept of how do you bring people together, how do you build those relationships, and I think we're starting to move into a different phase, which is what can we actually do differently together. So I hope, for example, some of the conversation on the health and wellbeing strategy that's coming over the hill will be how can we as place-based partnerships really take some of that and actively turn that into hopefully some really good pieces of work for our local communities.
Thanks, Nicole. I'm really excited about place-based working and the fact that instead of just what we as GPs do in our surgeries, etc., it's actually going out into the community and changing what's going on in people's homes, in people's lives, in people's work, etc. And of course, that's the whole basis of preventative medicine, and that's the whole basis of success going forward. If we can't achieve that, then all we're doing is responding to illnesses as they happen, with more and more people on waiting lists for hospitals. So this has to be the future, and we have to make it work, basically. Sheila.
I've got to be parochial and ask you why Basset Law's hardly been mentioned. You said it's in this thing, but you know it's quite a big area, and you said ICS isn't going to come to Basset Law until April. You know, it's why are we being left? Because we're at top end.
And this is just from an NHS point of view. So I would very much agree that this doesn't make any sense, and I think that's why sort of legislation changes have happened much further up the food chain to sort of bring this together. So certainly I know that the health service across Nottingham and Nottinghamshire has been very much working together, and over COVID that is exactly what's been happening. But I think as a sort of technicality, it's in April that Basset Law officially becomes part of our integrated care system. But that's more of a technicality than an actual working relationship point of view.
I can absolutely Basset Law were in there. Maybe I didn't draw out some Basset Law examples, but more than happy to sit with you and discuss what happened in Basset Law and some of the learnings from that. So yeah, absolutely, they weren't left at all. Really key part.
Jonathan.
Thank you, and I wonder if I might pick up a couple of things. And first of all, thank you, Lana and Karen, for what you shared. And within that actually is wrapped up an acknowledgement as well of the insights and learning which residents are sharing with us, and we absolutely rely on. So if they were sat here, there'd be a proper acknowledgement of that too. So thank you for what you're sharing and for underlining to me that this is about culture change, the importance of that ownership from communities, and all of those things that are wrapped up in a strength-based approach, and not a kind of a top-down, one-size-fits-all. So I'm hearing that. Just wanting to link up what you were sharing with the questions that you posed to us, and I think that some of them you may have answered, at least in part, as you went through the presentation. So I was noting down a few things, but in response to the questions, clearly what we're able to work on with our residents is something that needs to be sustained. So I'm clear about that. I'm clear too from what other colleagues have already shared, Nicole and others, and from initiatives I'm aware of within the council, that we do need to make sure that we continue, as I think you are already, joining up what we're doing as we seek to work alongside some of our communities, so that we don't end up approaching them with half a dozen different approaches, all well-intentioned but slightly disconnected. So there's a couple of things there for me in terms of what would look good. I am going to throw the question back to you, though. I think you partly answered the questions, but I am still interested, here or outside of the meeting, to learn what else we might do as a partnership to sustain some of this. The other thing I wanted to mention, if I might, Chair, was just engaging with some of what Nicole was sharing a moment or two ago about the importance of the place-based working, and to use this as an opportunity to trail the Health and Wellbeing Board meeting and workshop, which takes place, I think, on the 23rd of March. That's going to be really important. First of all, to share with you where collectively all of our organisations have reached in drafting the new joint health and wellbeing strategy. That's one bit. But then to have a good conversation with partners about how we go about implementing and delivering that. And I think an absolutely key part of that is how we work with places, properly harnessing one another's energy and momentum and capacity, and that includes districts and boroughs, NHS colleagues working in places as county council as well. So that was really a trail for that. Thank you, Chair.
Yes, just to echo Jonathan's invite to the Health and Wellbeing Strategy Workshop. As I say, this is probably the most exciting time for public health that I've known since I've been a GP for 31 years. Everybody is coming out of their bunkers, the hospitals, the local government, the GPs, and working together in partnership in a way that's actually tangible. You can actually see it happening. So it's more than just words, as we've heard today and heard from Nicole, etc. Councillor Martin.
Yeah, thank you, Chair. Yeah, I think it's a very interesting piece of work, especially putting my district councillor hat on. We took a place-based approach quite some time ago for Ashfield. You know, I'm not going to go on too much about it, but the place-based approach is quite relevant, really, because Ashfield is a very diverse district. So we have two rural areas, well, three or four rural areas. Then we've got Hucknall and we've got Sutton and Kirkby, and they're all completely different to each other. And obviously, the levelling up agenda has helped us greatly because we've had a really cohesive strategic plan, and we've got over 62 million coming in to alter Sutton and Kirkby, so the town's funding there. And we have spent 22.5 million on leisure centres in the three different areas because we recognise the importance of their value quite some time ago. And alongside that, we've also spent over 5 million on recreation grounds. And the reason I'm saying this is because it's down to district councils to get the finger out and do it. You know, that's the job. That's what they're there for. That's what people want. When you go around the different areas and you canvass the different areas, you can see the poverty where it is. You can nail it, and that's what all the districts need to do. So it's all right sitting there waiting for everybody to come along and do it for you, but you've got to get your finger out and do it yourself, haven't you? That's where it is. And in Ashfield, especially in like Coxmore, Corsic, Leamington, you know, they're probably some of the highest deprivation levels in the country, and it's really important. And the other part of it is as well, we've got a hub, so we have the police and the community protection in the same building, so they can talk to each other. That's really important because what changed the lives of the community protection officers was cameras. Because that made them effective for the first time ever. People weren't just running away from them. And it's little things like that that make all the difference. So working with the police, helping them, supporting them, and having regular community protection officers going into the same places at the same time. I'm talking about lighting and internet access. I've had that in Jacksdale, where it's a little village, and they got loads of people hanging around the back of the community centre just so they could access the internet. So in the planning, we put micro bar over the road. We put seating outside of it, and that stopped the antisocial behaviour. Just little things like that, and it's knowing your areas. So it is place based, and it's very strategic, and it involves many different levels. Thank you.
Yes, as you say, leisure centres, absolutely the focus where you can get people going. But I had somebody approach me last week to see if they could use the surgery for sit to exercise, just to get people sitting down, moving their arms, etc. And walking, as I said, is hugely valuable. But it is the lighting, it is the safety, it is all of it put together. Jeremy.
Thank you both for really interesting presentation. I've got lots and lots of thoughts. I'll try and put them together in a logical order. I think what you say is really, really important about understanding the complexities of the nuances, the subtleties around how you actually move everybody further towards in one direction of actually taking more exercise. What we don't want to do is have strategies that create populations that exercise more but actually leave people further behind, so we widen our health disparities. That's really important. So actually understanding what the blocks are to individuals, being individuals, families, communities, being able to have exercise as a key part of their lives is really important. I also think it's quite fascinating because if you actually look at, for instance, our national football team, the majority of them have come from working backgrounds, council estates. So they've come from those deprived communities. So there's been something in place that has actually made exercise a critical part of their lives that's enabled them to do that on a world stage. So, but not everybody can be the superstars, can they? So I guess one thing that I always think with anything like this is it's not just individuals don't exercise by themselves on the whole or start taking exercise. They're usually inspired by someone, whether that's friends or mentors, role models, parents, and often volunteers. And so I was interested in where in your strategy there is for the encouragement of the volunteer roles and how we provide support to them, because there's no doubt that the people that run that do the sports clubs or inspire individuals are really, really critical. So that's number one. Then there's about the lessons from models where there's been really visible, successful collective exercise. So, for instance, your park run model, which I think is a phenomenon. It really is, but it's not everywhere. And how do we get, maybe how do you take a visible model like that actually is something that's visible within communities, and actually how do you take that to maybe more deprived communities? We mentioned about playing fields. It's obviously it's a different role here, but have we got the right playing field strategy? And not necessarily about green space, but actually, do we have to create cages within communities where people can actually access exercise where there isn't green field space to develop? And then another thing, the last thing, was about how do we actually encourage our workplaces to be healthier? I look at my own practice. I have a CQC making an assessment of my practice about how good it is for the care that we're providing. But there's nothing that actually that my workplace has that says it's a healthy place to actually be working in the first place. I suspect there's an awful lot of people sitting behind desks that don't do an awful lot of exercise. I know today that I've been an inactive day for me. I've done 1,200 steps today, compared to what I would do when I was off work last week doing 10, 15,000 a day. So if you know, there's going to be an awful lot of pressure within our community to revitalise our economy as we come out of COVID. That's going to mean workplaces are going to be looking to potentially put pressure on people to work harder, work differently, potentially not be as active. So going forwards, how do we kite mark a healthy workplace? You know, is there something that we could have around that actually states that, you know, Active England, you've earned something for your practice, that actually says that your workplace actually goes out for a walk as a practice, or, you know, or something. So a few ideas, but I'd be interested in your thoughts.
Yes, thank you, Jeremy. I can agree that general practice doctor surgeries are indeed an unhealthy environment in which to exist. I'm still eating the Christmas biscuits. It's the only way to get through the day. I'm going to wrap Jeremy's question up with one question from Councillor Turner. Then we're going to bring it to an end, but we're going to throw that over to you. So get thinking. We'll come back to you in a couple of minutes. Councillor Turner.
This fascinates me, and I love the concept. Fortunately, I've been involved in something like this for the last 16 years in Bassetlaw. So a former district council leisure centre which was saved by the local community, and we've been, sorry, that's the role. We are retired in April last year. That venue has been run by the community for the last 16 years. This concept works, but you have to have the community behind you to make it work. The facility that I was heavily involved in, I called it cradle to grave, perhaps not the greatest description, but basically 3 years to 90-odd-year-old people, all coming in, participating in one form or another of activity, all under the same roof, all doing various and different activities. So an example would be you'd have a kids gymnastics club one evening, and at the same time you'd be running a mum's fitness session in the fitness suite, something like that. So there's bags of scope for this to work, and I mean Sheila will be familiar with the place that I'm talking about. It's something that I'm really passionate about. Got bags of knowledge on it. It works, but you've got to get the community behind you. In the 16 years I was involved, we, because of how diverse we were, how innovative we were, we raised 1.1 million from such people as Sport England and National Lottery Community Fund, etc. And all this was done without any experience whatsoever. And at this moment in time, and for the last 6 years, that facility has been self-sufficient, so it gets no support from any authority, whether that be a local authority or a county authority. So I'm all for it. Thank you.
Thank you, Councillor Turner. I'm going to let Karen have the final word, if that's all right, Ilana, without splitting up.
There's a few
Karen, if you can
questions
remember from
coming
Jeremy
back and
Peg.
Jonathan as well.
Go ahead.
So, Councillor Ted, that's great in terms of in that area, and that's the real strength base, one of the strengths within that community, and a great success story. And then you know, where you have those a great model to run from. It's where you have in other areas areas of severe, you know, challenges, deprivation, where health inequality is the highest, where there's nothing. And that's brilliant, and that's exactly how it should be, for the community, by the community. But there are other, you know, huge amounts of swathes of our county that don't have that, or even access to leisure services, or would even step foot into a provision, if you like. So how can you grow that out into the community? But great, and I'd be really welcome to learn more about that. Jonathan, your certainly the links into the local area coordinators, and obviously with Cash, with adult social care as well, we're linking into all of that as to where they're happening. And funnily enough, they're in exactly the same places as to where we're going to where their local area coordinators are being asked to work in. So we're linking all of that up, and that's happening at the moment. And then Jeremy. Yeah, there's lots of work happening around more capacity funding coming from Sport England around facilities, and what does that look like? And it's more than a football pitch or a green space, and it's how can we really work, linking into the levelling up agenda actually, how can we really make sure that the facilities there in certain areas of our county that we have identified now, and having that base knowledge, we can be really targeted as to what's needed and where, and what's going to have the greatest impact. Around the workplaces, absolutely fundamental to that. One of the key things, and unfortunately in our county, I think we've only got one registered active practice, which is Gamston Medical Centre. So how can we get more of our practices kite marked with Moving Medicine programme, which is active practices, which is great, and I'll give you some more information on that. And that's certainly what we'll be working with the likes of, certainly in Rushcliffe, what's his name? I can't remember his name off the top of my head, but we're working with the district council because they have a health lead, health officer, and one of his targets was to how can we get more of our practices in Rushcliffe set up as active practices. And I think the Nottingham West as well, there's some great opportunity in there to do that. And it's healthy workplace as well across the board, not just GP practices, but we absolutely know that trusted source of particularly medical professionals, if they're advocating for people to be a little bit more active or moving a little bit more, that holds so much weight. And how can we increase that advocacy from those trusted sources, whether that be a GP, whether that be a healthcare professional, a teacher, a volunteer, etc. So back to your volunteers as well, fundamental in terms of our workforce, and how do we help to inspire that, and get out and have those conversations to enable more people to be more active in a way that works for them. And that's really important. It's what works for them. So we can put things on, we can build it, the mentality of build it and they will come. Some people will, and they absolutely will. And you might have a full park run. And that's brilliant, and that should continue to happen, and leisure services should continue to happen, sports clubs, absolutely. More often than not, it's those that are already active or have the mindset and the behaviour that are more likely to seek that out. It's those people who may be living in isolation, older adults, maybe those with a long-term health condition, those with a disability, those who maybe have 5 children under the age of 10 at home and can't physically get out. So there's lots of nuances within that, and it's not a one size fits all, but it's all of those things. You can't just do one thing. It's all of those things, and how do we grow it? And we have to grow it together and go, actually, let's try some of this. That's the conversation.
Fantastic, Karen. I think you've closed it beautifully there, but you have the potential to do a workshop all on your own. I do remember many years ago a GP from Cripps, I think it was a Dr. Helen Garr or something like that, who was doing stand to consult, where she had no desk and no chair. She used to stand, and the patients used to stand as well. And I thought about it, but I didn't actually do anything about it. I've still got my chair and my table. Thank you very much indeed. We move to the recommendations, the Health and Wellbeing Board to support making our move strategy and consider how we can work together to achieve its shared vision and aims and apply the learnings from the health, wellbeing and physical activity inside work in future strategy development relating to the Nottinghamshire Health and Wellbeing Board, and to identify where the priorities of the Making Our Move strategy align with and embedding and adopting it within the Joint Health and Wellbeing Strategy 2022-2026. I moved that. Do I have a seconder?
Could you just repeat that for me, John? Yeah, I second that.
Okay, seconded. Thank you both very much indeed. Oh, sorry. Does everybody agree? Yes, yes. Stand up if you agree. All right. 5. If you thought item number 5 was exciting, wait till you get to item number 6. Item number 6 is the Nottingham Food Chart and Sustainable Food Places. Now, anybody present should hopefully remember a motion that came before council only a couple of weeks ago. That was a motion that put forward that we are in nothing less than a nutritional emergency, such as the state of nutrition within Nottinghamshire County Council. And what we're talking about here in nutrition is nothing other than an adequate and well-balanced diet. And yet, we have 15% of children turning up at 5 years of age to school being overweight or obese. We've got something like 20 to 25% of kids at year 6 at the age of 10 being overweight or obese. We have parts of Nottinghamshire, such as Mansfield, where 72% of the population are overweight or obese. We've got huge amounts of health inequality brought about by nutrition, probably second only to smoking as one of the greatest causes of reduced life expectancy and reduced healthy life expectancy. And the thing I pointed out was that if you have a young child who's in an accident at 6 or 7 years of age and you cut open their arteries, the fat is already starting to aggregate on those arteries to cause narrowing, to put them in blood pressure problems at 40, heart attacks at 50, strokes and an early death, and leading most of their adult life in ill health. This, ladies and gentlemen, is a staggeringly important area and fits in exceptionally well with what we've just had around activity. Now, not only did we decide that we did need, before the NHS is overwhelmed and inundated by the complications of that, we agreed to set up a food champion for Nottinghamshire and indeed to progress our food charter and sustainable food places. This is something myself and John Wilcox started doing in 2017. So it's been slowly evolving. But John, I feel it's coming to the boil. And with that, I pass over to John Wilcox to tell us about the food charter and sustainable food places. Thank you, John.
Okay, thank you, Councillor Doddy. I'm trying to think of a pun to follow yours, but I think the only thing I think of is so I'll try and follow the tour de force with some food for thought. That's all I can come up with. Okay, so yeah, thank you for having me. It's nice to be back in County Hall. I think it's the only second time I've been in a long time. So I'm John Wilcox. I'm one of the public health managers in Jonathan's public health division at the County Council. So yeah, I'm here with regard to the report you've got, which has got two purposes. One is to get your support and approval of a food charter for Nottinghamshire, so I'll be telling you a little bit about that, and also to get your endorsement for working towards, as Councillor Doddy said, something called sustainable food places. Okay, so as Jonathan said, from a public health division point of view, obviously a lot of us have been hard at work on the COVID response. But one of the things me and my team have done since we've gone back to our more business as usual work in November, we really wanted to go back to this strategic work around the food charter that, as Councillor Doddy said, we actually started looking at in a Health and Wellbeing Board workshop in 2018, but a lot of this, from our point of view, the strategic work around food has been on pause all the way through the pandemic. So we just really wanted to get this work restarted towards the end of this health and wellbeing strategy cycle as we move into the next health and wellbeing strategy cycle. So improving the food environment is a priority of the current health and wellbeing strategy, and that comes under the theme of healthy and sustainable places. So it very much links in with the excellent presentation we've just had around physical activity, which is great to hear how that's progressed. Okay, so during the pandemic, there's been lots of really fantastic work across all our organisations working together on the COVID response. So what's really important is that we take this opportunity, I think, as we build our work going forward into the next health and wellbeing strategy to really think about what we're going to do together around food and nutrition. So the slide that's up on the screen there, some of you may have seen this at the Health and Wellbeing Board workshop around the strategy. So what this is showing is the risk factors for years lost to illness or disabilities. So this is one way of thinking about health impact. And as Councillor Doddy said, diet on its own as a single risk factor is the fourth largest contributor to years lived with disability. But the other things I've circled on there, overweight and obesity, food and nutrition contributes to that, high blood pressure, food and nutrition contributes to that, and I think there's a separate one around child malnutrition, obviously diet contributes to that. So yeah, the food we eat and the nutrition we get from that is really important for our physical health. But I think it's also really important to remember that food is also really important in a wider well-being sense for people's mental well-being. We all have to eat, and we've all got different relationships with food. And food we can use as a way of bringing communities together. There's lots of excellent, there's probably a lot of people projects across Nottinghamshire which you can categorise as social eating projects or other projects where as part of what they do, they provide food, people get together and cook. And that's not just about the nutrition, it's about the well-being benefit that it brings to people from doing that. And the other important thing is if we step back a little bit and think in a wider view about food, is that food is also really important from an environmental perspective, because the food system in the UK is one of the biggest contributors to carbon emissions and greenhouse gas emissions. So, and climate change has a really important impact on health and wellbeing. So there's lots of, as with the previous agenda item, there's lots of complex ways by which food interacts with health and wellbeing. So next slide, please. Okay, so I'll put this slide together. So although there's a lot of complexity, and I could put up a really complex diagram, I guess I've tried to simplify maybe the current right now priorities around food into some simple points. So one really important around food that we'll all be aware of during the pandemic is food insecurity, or sometimes referred to as food poverty. And obviously right now around the cost of living rises. So that's a really important focus for us. And as Councillor Doddy said, that's at the County Council that was recently included in a motion around food and nutrition. The other really important aspect, again, that we all know about during the pandemic is the food supply chain. So food systems and how we get food and how food gets to our local communities is really important. And again, if we think about a wider sense about health and wellbeing and about jobs and the jobs people have in the food industry, how food is grown and how food travels across the world and across the UK, that in itself also has an impact on health and wellbeing in a broader sense, and it impacts on individuals. And then, as I said earlier, how food is transported interacts with the climate emergency. So these sort of aspects around food and health that we talked about first, food insecurity, food and climate, food and the economy, they all really interact. But at a local level, there isn't one single agency that is in. You haven't got a Department of Food or a local Ministry of Food. So what's really important is that who's going to take that leadership. And I think it's really fantastic that the Health and Wellbeing Board in the current strategy took that leadership around food environment, and I really hope we can continue that. The UK government also sees food as important. So food is mentioned in lots of health strategies, including the obesity plans, and the government a couple of years ago did commission this national food strategy, which I believe we're waiting for the government's policy response to that. But again, that basically looks at food from a national perspective in that broad sense that I've just talked about. Okay, next slide, please. So going on to the food charter. So as I've said, it's really important that some agency in a local area takes that civic leadership around food in the local area. And what a lot of areas across the country have done have decided to represent a local vision, a call to action, and priorities around food in the form of something like a food charter. Not everywhere's got a food charter, but lots of areas across the country, cities, counties, districts, have already got a food charter or a food strategy that presents that vision. So back in 2018, at the workshop, one of the actions that we took from that was to start to develop a food charter. So during 2019, we did a lot of engagement with Health and Wellbeing Board members, with community organisations that at the time were involved in various aspects of food. We did some public consultation through, at the time, there's a email and mailing list for the Health and Wellbeing Board, so we utilised views from that. And then we took all those views together with the evidence base around this broader view around action around food, and looked at other food charters that were good examples of practice elsewhere in the country. And we put together that food charter. So basically the food charter was ready to come to the Health and Wellbeing Board just before the COVID pandemic. So it's sort of been on the shelves since then. So as I said at the beginning, what we wanted to do was really bring this back to life. So we've reviewed the food charter, the wording within it, which you'll see in a minute on the next screen, and you've got in your packs. And we felt, and again, we did some sort of rapid engagement. One of the things we've got that's really good now in Nottinghamshire, working with Nottingham, we've got a food insecurity network, which brings together partners from grassroots groups that are doing work around food, right through to district councils and big organisations. So we got their views on the wording of the food charter. So if you bring the next slide, please, Bryony. So it's going to be very small on there on that screen, unfortunately, but you've got it in your packs. So this food charter is a one-sider document, and at the top, the wording, it presents a vision for why we think food is important in Nottinghamshire. So it's recognising that good food is vital to the quality of people's lives, and it plays an essential part in improving health and well-being and reducing health inequalities. And that everyone in Nottinghamshire, no matter what their age and where they live, should have access to good quality, healthy, tasty and affordable food. And we want that food also to be good for the local environment and for the local economy. At the bottom of the food charter, we've presented 3 different priorities as to why food is important for us. So the first one is really food for communities and for individuals, and that includes aspects around the importance of tackling food insecurity and making sure that vulnerable residents have access to good food. But it's also about celebrating good healthy food, and it's also about the important thing around making sure that everybody's got the good messages around food and nutrition. The second theme is around food and the economy. So as mentioned, food is a vital sector to our local economy. But the other way to look at it also is that food on our high street is really important, and we know that sometimes as we walk down our shopping streets or local precincts, that we can have clusters of food which doesn't give people good choice. You can have a whole band of takeaways selling high-fat, high-sugar food. So it's really recognising that we really want the local places to give people the opportunity to have access to good food. The third theme, as mentioned, is recognising the importance of food in relation to environmental outcomes. So this includes things such as reducing food waste and packaging, For instance, I think that the county council leaders, people who work on waste, are doing a new campaign around food waste soon. The importance of recycling, and when we're thinking about food growing, such as through community gardens or commercially, really thinking about the importance of food and nature and biodiversity as well. So that is the food charter. So really, if it's endorsed today, what will happen? It'll be available on the county council's website, and then it's for us to use collectively going forward as our sort of strategic banner, saying why food is important to us and for the residents of Nottinghamshire, and therefore it's a tool as a call to action both for residents, for community groups and for organisations and for businesses that we can then use as a tool going forward. So a practical example of using it is I went to a meeting with local hospital leaders in the ICS around food, and to enable them to have that conversation around what they could do differently in hospitals around hospital food, around food waste. They use the food charter on the screen straight away to say, look, we've got a strategic priority around food in Nottinghamshire. We really need to do something around that, and then we can pick off some of the points in the food charter to steer that strategy. Another way for residents is we're going to work with the communications team at the county council to develop web pages with information around food. And then what we'd like to do going forward with partners over the next years is have a communication programme whereby we can link in things such as social media messages, and as we already do, publicise the good work that's going on around food in Nottinghamshire. So I'm going to move on from the food charter itself onto, okay, so what are our plans going to be? So as I said, we're emerging from COVID response onto this agenda, but what we want to do is really build on the excellent work across Nottinghamshire from community groups, councils working together, NHS bodies working with councils, working with businesses around the pandemic. So as I've already mentioned, we've got an excellent network of food initiatives working together that we want to build on. So we want to build our partnerships around food and basically identify the good practice, such as food growing initiatives, social eating initiatives, things that are bringing people together around food, and really look at how we can support those initiatives collectively together. So I know a lot of the district councils already doing some fantastic work with their local food initiatives, campaigns like Feeding Britain, that we really want to build on and link together over the next 4 years. So one way we can do that, as Councillor Doddy's intimated, is there's a national programme called Sustainable Food Places, which is led by a couple of national charities that work around food and sustainability. So again, several areas of the country are already part of that programme. It used to just be focused on cities, because it used to be called Sustainable Food Cities, but it's been recognised that towns, districts, metropolitan areas, counties can also work together around that. So what we want to do is become part of that national network, if you like, and work towards Nottinghamshire being a sustainable food place. So in the report, I've set out some of the things that we would need to do and consider. So the things that you need to do and consider to become a sustainable food place are very much in line with the food charter. So it's thinking about food security, thinking about how we procure food, looking about making sure you've got consistent messaging around food. So what we'll be doing is forming plans, working in the structure with place-based partnerships, district councils, and really advocating this collective approach around food. So finally, going on to the recommendations. So the two recommendations that I'd like you to consider is approving the publication of the food charter for Nottinghamshire, and any other considerations that you have got with regard to that, and getting the board's endorsement around working towards Nottinghamshire becoming a sustainable food place over the next couple of years. Thank you.
Thank you, John. I worked with John previously on a programme that's going on at the moment called the Childhood Trailblazer Obesity Initiative Programme, where Nottinghamshire was selected as one of only 5 counties in the entirety of England looking for the holy grail of the reduction of childhood obesity, and a number of initiatives were looked at with regards to that, and of course central to that was the understanding of parents with regards to food and the food environment, also how to cook, etc., and the multitude of things that go into having an adequate diet. It's very clear how all of the things this afternoon are dovetailing with the activity, with the obesity, with food, with health and well-being. From the work point of view, as John said, it'd be great to get workplaces looking at their employees, and as they now do, they have mental health champions that can recognise somebody who's anxious or depressed or having a mental health crisis, looking after them from a tobacco declaration point of view. We'd really like them to understand that the way they feed their employees and the way food is made available should be changed into some sort of a healthy, sustainable way, in the same way as we look at other aspects of their health, and for them to have health champions, etc., within those environments. It's a vision. It's not a roadmap. It doesn't have a series of steps. It's a vision, much like place and place-based interventions are visions, and those visions are put in place by partnership working. So a fantastic introduction to something that we will be evolving through the health and wellbeing strategy, through the election of a food champion for Nottinghamshire, and through our partnership organisations. And I'm going to throw that out there to see. Jeremy, would you like to come in on that?
I'd just pick up, I mean, obviously the whole thing is very, very important. I'd just like to pick up on one thing, and that's the skill of cooking, which I suspect, obviously it's been highlighted in national media, but I just wanted to know whether there's going to be particular focus on that at a school level, at a community level, because people, if they cannot, you can give them all the food that you want, the healthy food, but if people can't actually do anything with it and don't know how to actually produce a meal and don't see the importance of that, then they're not going to actually act upon that. And I just wonder whether that particular area is going to have any more focus this time around. Are the lessons that we can learn? Because people won't go into a takeaway if they know how to actually create it themselves. Because it's going to be cheaper for a start. It's probably going to be healthier. It may be a reflection of the speed that people live their lives, and but I do think that that's an area that is important for us to focus on, and what the strategy is to actually have more people able to actually have basic skills. So I'd be interested on your point, just on that particular area.
Thank you, Jeremy. Do you ever remember Ready Steady Cook, where they'd give you a turnip and an onion and they'd be able to turn out a 3-course meal? That's the sort of answer we're looking for, John.
Yeah, that's actually still on TV. I was quite surprised. Okay, yeah, I completely agree with what you're saying, Jeremy, and I think that is a really good example of what we can refer to as a negative feedback loop. So what I mean by that is, if you think about the whole country, as people on average less people cook, there's more convenience foods in supermarkets. As there's more convenience foods in supermarkets, people don't need to cook as much, so they don't learn to cook. So then there's less people cooking, so there's more food, there's more convenience food. So I think that's a good example of a feedback loop. So what we're doing about that in Nottinghamshire. So I think a good example of what we're doing at the moment is such as through the our early years food environment focused child obesity trailblazers. So across Nottinghamshire, we've got what are called food clubs developed in children's centres and other community venues. And some of the things we've been trialling out through that, for instance, working with Your Health, Your Way, which is our commissioned obesity integrated wellbeing service, is basically families with young kids, in this case, in the children's centres, get the sign up to the food club. They get some a nice healthy box of food for a very cheap price. This is sourced via FareShare, via supermarkets, and as part of that, they get a healthy recipe card. And then what they then go away is then have a go at cooking that. And then that's that. We've tried out linking that in with videos and video guidance, and we've got lots of evidence, and we've done some evaluation as to where that works. And then we've also got recent experience across Nottinghamshire of doing various types of what are sometimes called cook and eat sessions. Yeah, so basically where you bring people together who want that support, and they learn to cook together. So as regard to our strategy going forwards, what we're doing at the moment in relation to our recovery planning, if you like, is really thinking about exactly that sort of concept, where we want to build on recent good practice, such as I've just referred to as part of the Childhood Obesity Trailblazer, and then scale that up using the resources we've got. And by the resources we've got, I mean through our commission services, but also with the community groups and assets we've got. So there's a lot of community groups in Nottinghamshire, as I mentioned, who bring people together to cook. So our role as Health and Wellbeing Board partners and us from Public Health is then to enable the community groups that do this anyway with the advice that they need if they want to help people to learn to cook healthily. Because I remember previously in a Health and Wellbeing Board meeting when we talked about this, there were a couple of examples maybe where sometimes community groups do bring people together around food. Sometimes the food's not great. I know my son plays rugby in Nottinghamshire. We go around the local rugby clubs. Sometimes all they get is after the match meal is chips. But there's a couple of ones. I won't name the good ones and the bad ones, but some of them do provide like healthy pasta with vegetables afterwards. So it's really putting in that work in terms of the food provision and the food skills. Yeah, so completely agree with that, and we'll take that to look for going forward.
So if I said, do we know how many out of the 16-year-old population, school leaving age, how many of our children in Nottinghamshire can cook at a basic level? Do we have that sort of basic information?
I don't have that information, and I suspect that if we wanted to get that information, because of the how schools are organised as separate academies, we'd have to do some survey work to ask each school if they collect that information, and if they don't collect that information, we'd have to collect it. So the short answer is we don't have that information. What we do if we can't get that locally, what we tend to do is look at if there's a study with a representative sample representing the Nottinghamshire population, and then extrapolate it. But it's definitely something that we could look at, but I suspect it would take quite a lot of resource to find that out. But we could look into it. Yeah.
Thank you, John. I've got Colin Pettigrew going to update us with the very latest information on the number of 16-year-old children who can cook starter, a main course, and a dessert.
Well, strangely enough, Chair, just this week, the Secretary of State for Education wrote to me to tell me and every other Director of Children's Services around the country that the White Paper for Education will include a requirement that all 16-year-olds are able to cook 6 healthy recipes by the time they leave school. That White Paper is due in the spring. I don't know when it will be implemented. And I have asked the Regional Schools Commissioner what those recipes will be, because no doubt Ofsted will have a view as to whether they're inadequate, requires improvement, good or outstanding. Haggis and neeps is my preferred. More haggis than neeps, of course.
Fantastic.
That is encouraging.
It is encouraging. Six meals. Of course, we haven't got round to talking about salt content of food, iodine. We haven't talked about sugar and reduced sugar content of food, high calorie content of preserved foods, etc. And there's a whole debate around the area of food and the sugar, etc. content, and how we can intervene at higher levels, Jonathan, to try and nationally reduce these type of things as much as locally. Colin, do you want to come back in? You've thought of another recipe, haven't you?
No, I have. Or was it 7 recipes? No, it's 6 recipes, definitely. And I'll share with John the correspondence for information and supply it to Brian so he can circulate it with the minutes. The point I was going to make, I think, Chair, and it links the previous agenda item with this agenda item and back to our responsibility of doing something different in the future. And I want to first of all acknowledge that at the moment we're just coming out the tail of the pandemic, so we've been responding to an emergency around food, and particularly children's food during school holidays. And we've done things that are quite admirable, but with some perhaps unintended consequence. So for instance, next week, and this is to be celebrated, recognised and acknowledged, we will hand out 25,000 vouchers through our schools to those families who are living in greatest levels of poverty and deprivation. And that will buy 125,000 meals in Nottinghamshire, £3 a day per child that is eligible for free school meals. But there'll be no link as to whether that's food that is a ready meal, or whether it's a healthy meal. Going forward, there's been agreement to fund the HAF programme, the Holiday Activities and Food, Holiday Activity and Food programme for the next 2 years at least. And we need to make that connection between the previous agenda item, this agenda item, and the work that Pom Bogle is leading in delivering that across the county.
Thank you, Colin, for that update. I'm going to go to Councillor Martin, and then I'm going to move to recommendations as I've got one eye at a time. Councillor Martin.
Yeah, I'm glad Colin came out with that, because that's very interesting that children are going to have to learn to cook. I was going to say, because the key to it all, really, for adults and for children, is education, and I think that's something we can have an effect over on primary schools, especially those primary schools that cook their own food, like in-house schools there, because they've got the facility and they've got the people to teach them as well. I'm just interested to know from John what we're doing as a county council strategically wise about the connection between our larger supermarkets really, and I know we shouldn't need them, but we have really had to have them, especially during the pandemic. Food banks, nearly sell by date food that goes to food banks. Is there any county governance over any of that, or is it just left to individual food banks across the county? And of course, the other thing is food waste. Because that contributes massively to food waste. If it gets to its sell by date and it goes back, where there are possibilities where it could have been used in food banks. I think there was one other thing as well, but I forgot where it is now. I'll let you go.
Thanks very much, Councillor Martin. And obviously, from a childhood point of view, we've had an amazing update from Colin on the fact that, a huge amount of vouchers and no food insecurity or poverty over holidays, etc., in Nottinghamshire. In terms of the food strategy, one of the core points put up there was economically, socially and environmentally acceptable, and a reduction of one of the points of food waste, which was specifically addressed within the content of the document. But I'm going to give the last word to John Wilcox before we move to recommendation.
Yeah, thank you. Yeah, just Colin's point just reminded me also in regard to Dr. Griffiths' point that we do have really good relations with the school meals team in the county council, who have linked in obviously with what Colin said, and they're an amazing team to work with, and we actually fund through public health a couple of posts who are going into schools and sort of linking the school meals into the education side of things. So I just wanted to mention that. And then with regard to the question regarding to food banks, yeah, quite rightly, as Councillor Martin said, during the pandemic, all councils working together have worked with food banks like never before. So before COVID, I couldn't have really told you what food banks existed in Nottinghamshire, and that relationship has really built. So I think is there a strategy going forward? I'd say at this point in time, not fully written, but that's where we want to go to. So I've mentioned the food insecurity network. So that network does bring together the organisations which lead the food banks in Nottingham and Nottinghamshire, together with other community food initiatives. So yeah, what we definitely want to do is to support and work with food banks, and in a broader sense around financial insecurity as well, because obviously that's the prime objective of those charities that run food banks, is to help people out of financial insecurity, and they're helping them with food aid. And then with regard to food waste, again, that nicely ties back into the food charter. That's one of the things we want to do. And for example, the food clubs I mentioned earlier, which are now in every district, they work with the national charity FareShare, who basically get food that was going to be wasted from the food system, so surplus food from supermarkets, and they redistribute it to community groups, food banks and other things. So we're working with them, and that's, as you say, it's a great opportunity for helping people who need that food in Nottinghamshire. So yeah, we'll take that forward as well. Thank you.
Thank you, John. And I'm reminded of the healthy options takeaways. I remember going to a takeaway with an award for them, where they'd moved from the 7-hole salt cellar to a 5-hole salt cellar. So when you shake it, you get less salt, because people traditionally shake it the same number of times. They have no idea how much salt comes out of it. I thought it was a really good invention. In any case, we're going to move to the recommendations to approve the publication of the food chart for Nottinghamshire on behalf of the Health and Wellbeing Board, and consider whether any further action is needed to agree to proposals for Nottinghamshire to start work towards becoming a sustainable food place, and consider what other actions are required. And 3, to use and publicise the food charter as a call to action in local partnerships, organisations and communities with the residents to further develop and contribute to improving the food environment. I move the report. Seconded. All those in favour? You're all thinking, what am I going to cook tonight when I go home? Right, we're going to move swiftly onwards. I see that time has gotten ahead of us, and I'm moving on to item 7, Joint Strategic Needs Assessments, Progress and Development. The core of the Health and Wellbeing organisation going forward will be the strength of its joint strategic needs assessments, which have been in place since 2008. So we've got 14 years of continuous development of joint strategic needs, something like 42 active chapters on Nottinghamshire Insight, highlighting the various areas that we see as important in the health and wellbeing of the people of Nottinghamshire. This is about updating the Health and Wellbeing Board on the progress on developing the strategy going forward. And I'm going to pass over to Jonathan. Oh, Sue, you snuck up on me, Sue.
Hello, I've snuck up on you, yes.
Carry on, Sue.
Thank you, Chair. I'm recognising time. Don't worry, I've just got four main points. Not to take up lots of your time, but just to reiterate what Chair has said about the importance of the Joint Strategic Needs Assessment. It's that continuous process to assess the health and wellbeing needs of the population of Nottinghamshire, particularly those health inequalities. And yes, we do have at the moment 44 chapters, but they are extremely important into learning what are our priorities going forward for our strategic planning, particularly the Joint Health and Wellbeing Strategy, which is currently under review, revealing those 9 priorities that we've updated you on, particularly the food insecurity and nutrition that's just been talked about. So that's one, just reiterating the importance of it going forward. Number 2, just an update around the steering group and strategic direction. So a paper was brought to the Integrated Care Board, the ICS, in July last year, just reiterating one, the importance of the JSNA, and also that integrated working with the ICS and our NHS colleagues that will become the ICB and the ICP, at least in shadow form, maybe in April, and that responsibility was acknowledged by the ICS moving forward. And I know the ICS is currently working on the governance of the JSNA and where it's going to sit in the new structure. So we're working with our colleagues around that. Just in terms of the strategic steering group, it was put forward that we're going to need a strategic group as well as an operational group, looking at the future direction of the JSNA and where it fits in that strategic commissioning cycle. So there is going to be a proposal going to it's got a very long name and I always forget what it is, the System Analytical and Intelligence Strategic Operational Group, that basically is an amalgamation of different leads for different data sources at NHS level, but also particularly at county council level and also wider partners, bringing together those data sources and how can we work together to make them more efficient, avoid duplication and gaps in our data knowledge. So that paper is going to be presented at the next group meeting there, just proposing a workshop where we can look at one, the future direction of the JSNA, but also those other data sources such as population health management and those system information dashboards that are being produced by the ICS at the moment. So hopefully that will be approved by that group, and so we can just really clarify where everything sits in the population health needs assessment. Just to say around the prioritisation process. So in the past, lots of requests kept coming in at different points for different topics for JSNA chapters. So it was needed a more of a systematic way of looking at this. It was started in 2019. There wasn't one in 2020, obviously due to COVID, and unfortunately quite a few chapters have stalled, and you can see that in the paper that was produced, but we're on our way again, which is good. Obviously this paper was to come to the January board, but because that didn't happen, we decided to start the process early, so people have enough time to send in their requests for topics that, and this is important, those are ones who are of a joint interest and strategic importance to the Health and Wellbeing Board. So there has to be a really good reason behind needing that topic, that JSNA topic. Also to reflect what's movements are going on behind the scenes in terms of data sources, we've also requested that what type of report people want. So do they want a full JSNA chapter, the full Monty chapters that we produce, or something slightly different for their needs. So that's been requested as well, and also any resources or support you can give to produce the chapters, because obviously the JSNA chapters do require a lot of work if you require a full chapter, so that resource and support is particularly needed. That's negotiable as to how we can work out who will be the author and how we can get those data sources. So just to say the recommendation or the request is the formal request for that prioritisation process to happen within the Health and Wellbeing Board. And thank you very much to those who've expressed an interest already. We've had a couple of formal requests come through with the completion of the forms, and also quite a bit of interest around topics. So it's just that formal request to members to please send in your topic requests that are of a joint interest and strategic importance, so we can move forward with the JSNA work programme for 22-23. Thank you very much, Chair.
Just generally speaking, for those of us sort of going out to work in localities and places, etc., you get lots of information from lots of places, from the global burden of disease figures down to our local population health management, down to our joint strategic needs assessments. To what microscopic level does the joint strategic needs assessment help us in developing our place-based interventions, which are going to be a core going forward to improve localities and their health and wellbeing?
That's a very good point, and that's a movement that certainly City are looking at place-based profiles. Theirs is around primary care networks, because there's only 8 of them, but for us we're linking with the work that they're doing and seeing if that could be perhaps done around district and borough level, and also our PBP level data as well. So that's a piece of work that's going on. But in terms of the JSNA going forward, that is a piece of work that we are looking at to see if we can make more chapters around more place, as well as populations and specific perhaps clinical needs such as diabetes. So it's to make sure that we get that variety of information out there. So yeah, work in progress.
Thank you, Sue. I'm going to throw that out there to see if anybody would like to ask a question. Jeremy, had you any input into requests for joint strategic needs chapters, or any interest in?
Chair, I have submitted and have had a reply, so thank you for that, Sue.
Thank you.
Jonathan, would you like to add to our progress?
Well, nothing to add. We were interested to hear those submissions, and we want to put a work programme together which represents the interests of the entire partnership. If you don't come forward with the suggestions, we have some ideas, yes. But it'll then reflect what we're interested in, what we think is of joint interest and strategic importance, yes, and may not account for what you can identify. Thank you.
Thank you, Sue. If there are no questions, I'm going to move the recommendation. And the recommendation is to refer to the organisation's strategic plans and commissioning intentions and identify topics for interest and strategic importance, and submit these topics for consideration for 22-23 JSNA by the 28th of February 2022. So time is ticking, Sue.
Time is ticking, but hopefully people have had enough notice prior to this meeting.
I move the recommendation. Seconded. All those in favour? Passed.
Great. Thank you very much.
Thank you very much, Sue. Right, we've moved on to the approval of the Better Care Fund, and it's the birthday boy himself, Cash. I'm going to go straight over to you to tell us about the Better Care Fund.
Thank you, Chair. You've had some really interesting topics, so I'm not sure whether the BCF is as interesting, but I will try my best to, stimulate the conversation. In terms of the BCF planning submission and plan, the national systems required all the local systems to put a submission back in to actually prepare a submission around BCF. We didn't have a long time to do this, so pretty much from 30th of September, when the BCF submission requirements were released, we had probably about 6 weeks to pull together a submission. Hence why we had to seek retrospective approval from Health and Wellbeing Board. And again, really appreciate and thank the board for being flexible on that. It was very much, again, an example of NHS England timelines and local timelines, governance timelines that didn't necessarily aligned with one another. But we managed to get the process concluded. Pleased to say that our BCF plans that have been shared in this with Health and Wellbeing Board have actually been approved by the regional team. They've gone through that assurance process, so that's also positive. I will just provide a quick overview in terms of the Better Care Fund. Members will know that the BCF has been around for many years. From my memory, I think 2013-14 was around when it came about. Very much around using the BCF as a mechanism to achieve or to deliver a range of community-based services that support people in the community and actually deliver on some of the national metrics that have been outlined. Some of those national metrics around preventing admissions, reducing length of stay, and also we've also got reducing admissions to residential care as well. So there are a number of national metrics that local systems have to ensure the plan delivers upon. I would also add that the plans provide a clear narrative on our ambitions around community transformation. So there are a number of community programs that support this work. So the community transformation work that aims to bring primary care, secondary care, community health services, social care, and the voluntary sector to deliver new models of care, and that work is progressing. There's been lots of co-production, co-design work around that community transformation work at a neighbourhood level, and that's again a key aspect, key feature within the integrated care system to deliver on that. Equally, there is the Aging Well programme again, which is again a nationally mandated programme, and again that brings a real focus on older people, needs of the older people's population, and also ensuring that we have sufficient community capacity and pathways, integrated pathways to respond to the needs of our older people's population. I would also make some quick reference to some other key areas of work that support this work, and again, carer strategy. As a system, we've been progressing really well on developing that joint carer strategy, and again, that is being progressed. And equally, we have a number of programs around learning disability, autism, and mental health, which again focuses very much on community, increasing community capacity and supporting more and more people in the community as well. So those are some of the key features around our community work. Finally, what I would also add to this is that despite the Better Care Fund being around for so long, despite the fact that we have a really good mechanism and we have a pool budget, so you can see that there is a total £99 million of pool budget to support this work. Integration between health and between health and care has been mixed, it's been patchy, there's been some good practice, but it hasn't achieved that integration that we would all like to see. So as a result of that, we have actually commissioned the Local Government Association to support in developing a programme of work that really looks at how can we develop a blueprint and ambition on how can we commission, deliver more integrated commissioning and also deliver more integrated pathways. So that iteration of work is commencing, and again, I'm really enthused and confident that work with the LGA will result in a programme of work that will also enable more integrated commissioning and more integrated delivery of care going forward. I will stop there and I will invite any further comments.
Thank you, Cash. Yes, I mean, the Better Care Fund, almost at the same time as Health and Wellbeing, back at the Health and Social Care Act 2012, and the structure that was required in order to move money between the NHS and local government through Section 75 agreements, etc. Something that couldn't have been previously done. Big budget, billions of pounds nationally, £100 million locally. largely predetermined projects and agreed areas to do that. I thought the Better Care Fund would expand to become the integrated care fund, and it was a possibility at the early stage, but the ICSs have obviously taken over from that, and it continues. But it's great to see that it's alive and well, and not only that, but you're seeking to expand the work of the integrated of the Better Care Fund. Jeremy.
Thank you for that, Cash. Pick up the word integration everywhere you go these days, and there are many different definitions of it. So I'd just like to understand a little bit about when you say that you don't think integration is happening as you would like it to. In what way do you think that there are? Where do you perceive the gaps? Is it in joint strategy? Is it in operation? Is it in metrics? Is it in conversations? Where are the gaps that you think? What would good integration look like from your perspective?
So, really good question. I think the work that's happened during COVID and the response to COVID, there's been a real emphasis of partnership work and a real evidence of how partners have come together to respond to that crisis. So there is a lot of appetite and a lot of examples of good practice during a crisis, and we want to build on that as a system. In terms of where progress is needed, I think we continue to have areas of commissioning that are still siloed. So again, there's an opportunity to look at commissioning in a more integrated, in a more joined up way. And that's not just between health and care, it's also between housing, public health, and other wider services. How can we actually take a much more strategic commissioning approach and actually use the joint strategic needs assessment more effectively and the analysis from our population health management work. So I think that's an area which all systems aspire to become more strategic commissioners, but also pool our resources to deliver the better outcomes for our residents. So that's one key area. But that's not going to be enough. I think what we also recognise for the lay person, accessing health and care is quite challenging in terms of navigating the system. There are so many different services, so many different pathways. So there's also an opportunity to really look at how can we integrate pathways, and that's across primary, community, social care, health and voluntary community sector. So there's a real opportunity to look at that. And again, there are a number of community programs like the Community Transformation Programme that is precisely looking at that level of detail. How do we bring all these different services together to make to be more integrated, and it's easier for the person to access those services and navigate the system better. So I think those are two fundamental areas where more progress is needed, and early iteration of the work with the LGA is already highlighting that there's some real opportunities to progress and use the BCF use the BCF as a mechanism to deliver that integration work.
Yeah, just one small point. I mean, I like that answer a lot, and it's very encouraging. Just a simple example from a GP perspective. So there's the development of an information portal, which is designed as a resource to share information. At the moment, it's mainly hospital based, but ultimately it's designed so that anybody that's accessing care information on care for these individuals will be able to look through different portals into other areas of work. I've been a general practitioner now. In March, I'll have been a general practitioner in West Bridgford for 25 years. I still can't get access to information about my patients from a social care perspective. So frail elderly people, I still can't find a simple solution so that I can access what their care package is and who's their main care provider lead. So when you talk about integration, And that's two-way. I suspect that from a social care perspective, that people can't access certain basic pieces of information. Integration for me will happen when those sort of basic communications are worked out. You know, there's a very simple. It seems relatively simple, but actually, unless we actually make it a priority that we can actually share information better, I accept joining up of pathways is really, really crucial, but you have to deal with the fundamental stuff as well. So that would be just a little bit of feedback.
Cash, is that the responsibility of the Better Care Fund, or an area that you're developing and or would hope to see?
Yes, Chair. So there is something called the Eco Platform System, which is our digital colleagues across the system are working on, which actually will enable that type of level of information across multiple organisations. It'll be shared across all the different partners, and so that's a platform that is being developed and considered, and again. I can share further details on how that's progressing. Absolutely recognise the current system, there are limitations around information sharing, but when I describe the two areas, I think what we've just described is another third strand of work, which is around systems and information systems that need to be more integrated and shared readily. So that's another area that is also part of the integration work.
So just to finish, Cash, there's always the concept that somehow the Better Care Fund has had its time and that it will disappear with the evolution of the ICB. You seem to be somewhat more optimistic and see a growth within the Better Care Fund. Who's right?
So really good question. So I think what we have done is we've got senior leaders across the system, across ICS and local authorities to review the BCF and actually review in terms of how can we use the BCF in a more strategic and in a more ambitious way. And so that review is we're using the support from LGA and from the Institute of Public Care. So they are our critical friends, and we're going through a really detailed iteration to really think about how can we use that as a far better mechanism. I think at the moment the appetite is to use the BCF as a mechanism to deliver integration and transformation, and that is something that is, I think, there's a clear consensus across the system to use that. So I think we've got to pursue that ambition, and again, I'll be very keen to provide further updates to the board as and when we begin to progress that some of the key actions.
Thank you, Cash. Anybody want to ask Cash before I move to the recommendations? I think you have. Nicole Atkinson.
Yeah, it was just to say. Oh, sorry. It was just to say. It's just come out this afternoon. Actually, the white paper, integration paper's just come out, and it's called "Joining Up Care for People, Places, and Populations," and that's got a section on financial sort of pooling of budget. So I think that might help to answer some of your questions, John, as to what the future vision set out nationally might look like.
Thank you, Nicole. Come to the Health and Wellbeing Board for the latest, up-to-date information delivered to you as it happens. There we go. Finger on the pulse. Quite right. Thank you, Cash. I think you've surprised yourself. You've made the Better Care Fund interesting. Thank you, and we'll have you back anytime, Cash. Right, we're going to move quickly to the work programme. Now, the work programme. Oh, right. Can we move the motion? Seconded. All those in favour? Fantastic. So we're going to move to the work programme. Never before has a work programme come before you with such critical importance as the one that you're looking at, particularly the Wednesday 23rd of March 2 p.m. meeting, which will be a unique hybrid meeting of in-person and workshop. So those two things have never been put together in a Health and Wellbeing Board before. Am I correct, Bryony? To your knowledge. Fantastic. It will be about the Joint Health and Wellbeing Strategy. We'll have pooled all the information that we've got. We'll be presenting it, some of it here and some of it in the boardroom, and that is Wednesday the 23rd of March. Can you increase the excitement, Jonathan? Possibly.
I've done my pitch
You've done
already,
your bit.
and at this time of the day, I don't think I want to add to it. Thank you.
Jeremy.
Yeah, I've said this before. Will there be any analysis of the previous strategy in terms of, clearly we've had a 2-year,
Yes.
there will be as part of that. So lessons
Yep,
from
we're on the
it.
case with that. Thank you.